Hello, and welcome to the Metabolic Classroom. My name is Ben Bikman. I am a professor of cell biology and a cell biologist. I'm a metabolic scientist as well, and that is always the theme of these lectures, which is how I like to refer to these. I like to imagine that I'm your professor. Thanks for attending lecture. The topic today sounds like a strange one from the get-go because I'm not an orthopedic surgeon. So if you've ever dealt with joint pain or osteoarthritis, or just commonly called arthritis, these aches in the joints, you've probably heard of a supplement called glucosamine. It's a pretty popular one. Often people will take it because they want to improve their joint health. They want to try to do whatever they can to alleviate some of the aches and pains. Now, this is a metabolic themed podcast, so you can wonder then, what does this have to do? What does glucosamine have to do with metabolic health? So in the lecture today, we're going to dive into why people take glucosamine, what it reportedly does for joint health, because it's not quite unanimous. And then we're going to shift gears and examine some of the surprising metabolic effects, particularly concerning insulin resistance and hyperglycemia. All right. So firstly, what is glucosamine and why do people take it? There is a name. There's something in the name of glucosamine that reveals part of its structure. It is what's called an amino sugar, and it is a component of cartilage. Now, of course, cartilage is in the joints. This is something that cushions your joints. And needless to say, if cartilage is compromised, joints are going to hurt. This can be what you hear sometimes when people refer to a joint as being bone on bone. If someone has that so-called bone on bone, it could be a problem of their cartilage. And again, a key component of cartilage is glucosamine. Now, glucosamine is often sold as a supplement, regardless of how they get it, whether it's from some natural source or whether it's made synthetically. It's going to be something that you're taking orally. Now, commonly, glucosamine is used for joint pain relief. Now, this is especially in people who have consistent joint pain or arthritis. What it's thought to do is to repair the cartilage, and in the process, help alleviate the friction of a poor joint, like the bone on bone, if you will, and thereby help reduce inflammation, and then thereby reducing stiffness and pain, etc., and increasing mobility. Now, there are a couple different ways you can get glucosamine. The typical forms are forms such as glucosamine sulfate or glucosamine hydrochloride or N-acetylglucosamine. But glucosamine sulfate is the most commonly used and most commonly studied. Now, if you have a glucosamine supplement in your medicine cabinet right now or your supplement cabinet, it'll very, very likely be one or multiple of these forms. Now that you know what it is, this amino sugar, let's talk about how it is apparently helping. What is it about the glucosamine that is thought to actually improve your joints? So the mechanism of action for glucosamine is that it acts as a building block for these other molecules, these bigger molecules called glycosaminoglycans. That's a big term. And these glycosaminoglycans are a key part of what's called the cartilage matrix, or just this sort of network structure of stuff. And it's believed that the glucosamine is going to help repair the cartilage by enhancing the building of the glucosaminoglycans. Now, there is some clinical evidence to show modest improvements in joint function and some joint pain reduction with glucosamine supplementation. But there's also a lot of evidence to suggest that it doesn't really work and that it performs no better in alleviating joint pain than a simple placebo. This is what you can find in both clinical trials as well as meta-analyses, where a meta-analysis is a study that seeks to identify these key outcomes like inflammation or joint pain alleviation, and then pile them all together across all kinds of studies and do a common analysis. And that is essentially what the meta-analyses find, what I just mentioned, that there can be some modest help, but if it is actually helping compared to placebo, it is in fact very modest. All right, so that is all the textbook understanding of what glucosamine is and what it is thought to help with. Now, but that's not the overall topic that I wanted to discuss today. So let's move into the metabolism, because while glucosamine is widely accepted for its potential benefits in joint health, and I don't mind if my skepticism is seeping in with that statement, but the story does not end there. If it did, I wouldn't be talking about it. So let's shift gears and discuss some of glucosamine's metabolic effects, which are decidedly not beneficial, and things that I think ought to be considered depending on the individual who is considering taking glucosamine. So let's transition into glucosamine's effects on metabolic pathways. As the name suggests, glucosamine is structurally similar to glucose. As I mentioned earlier, it is an amino sugar. So that has an amine group, like a part of what you'd typically find on a protein with this little nitrogen group. But then it's attached to this kind of carbon ring structure of which you would expect to be like glucose. And so it does look a little like glucose, but it is, of course, distinct. Glucose does not have an amine group. So glucose is not an amino sugar, it's just a sugar. But glucosamine is a little bit of both. Interestingly, and it is fascinating, glucosamine is similar enough to glucose that it even can use the same transporters as glucose to get into cells. So glucosamine is a big molecule. It is going to have, and it's polar, so it's going to have a hard time getting into a cell. It needs to have a doorway that can allow it in. And the doorway that allows it in are these two types of glucose transporters. Now, you could say, well, they should be called glucosamine transporters, and that wouldn't be wrong. So there are a lot of glucose transporters. I think currently there are probably 14 or 15 that have been identified. So there are 14 or 15 specific types of doors on cells throughout the body that allow glucose to come in. Now, people typically think they all need insulin to work. Only one of them needs insulin to work. And even then, there's a back door. But for all the rest of these glucose transporters, they're basically just open doors waiting for the glucose to come and just flow into the cell to be metabolized, whether it's burned for energy or stored for later energy use as glycogen or fat. Now, of those multiple distinct glucose transporters, there are two that are known to have the ability to move glucosamine as well. The first one is actually GLUT1, so the first of all of them. This is GLUT1 is a ubiquitous transporter, so you find it in cells throughout the body. You have GLUT1 in the brain, and you have GLUT1 throughout the red blood cells. So this is how certain tissues throughout the body would be getting some of its glucose. As I mentioned, GLUT1 has been shown to transport glucosamine. Although it's better at transporting glucose than it is glucosamine. It has a higher affinity for glucose. It is more glucose is a little more attractive to the GLUT1, that particular glucose 1 transporter, or the glucose transporter 1, I should say, GLUT1. But that, as I mentioned, there's another one. The second one is GLUT2. This is actually the primary transporter for glucosamine. GLUT2 is one that I'm very familiar with because it is the primary glucose transporter on very metabolically relevant tissues like the liver or the beta cells of the pancreas or the highly metabolically active kidney and even the intestines. So GLUT2 is very, very prevalent throughout the body. However, even though it is called a glucose transporter, you could make the case that it should be called a glucosamine transporter because it's actually more selective. It has a higher affinity for glucosamine than it does glucose. This means that glucosamine can be very efficiently transported from the blood into the cells by GLUT2. All right. Now, all of this is simply interesting, certainly with a metabolic relevance, and I'm going to revisit the metabolic relevance in a little bit when we start talking about some of the clinical studies, which is what I want to get into now. So let's talk about some of the clinical evidence of the studies that show some metabolic consequences of glucosamine use, and then we're going to transition from these human studies, and in the time we have, I'm only devoting time to the human studies, not the animal studies. Although when we transition from studies into the mechanism, In other words, what is it about the glucosamine that can be causing some of the metabolic consequences that I'm about to explain? Then it's a mix of some human, some cell work, and some rodent work. Okay. So first study. So there are several studies, and I'm going to take the time to go through several of them that show an effect that suggests that glucosamine supplementation can impair insulin sensitivity, thereby not only promoting some insulin resistance, but also increasing blood glucose levels. All right. So the first study was published in 2006. And this one is a small clinical trial, but it is a clinical trial, which is the best way to do a study. And they examined the effects of intravenous glucosamine infusion. So this is not the same as eating the supplement, taking the pills or the powder of glucosamine. But they looked at the effects of the glucosamine infusion on insulin sensitivity and plasma glucose in healthy people. So these were people that were generally healthy, but it did include participants with a family history of type 2 diabetes. So even though the subjects themselves did not have any evidence of type 2 diabetes, they were able to identify people without a family history, for example, a parent who had type 2 diabetes, or people who had none. And those people with a first degree, an immediate relationship with type 2 diabetes, we would say that they have a genetic predisposition to type 2 diabetes. Now, that is important for me to elaborate because that's going to be a theme of many of these studies that we go through, looking at people with a family history of type 2 diabetes. All right, now what did they find in this first study in 2006? They found that the participants that had a high dose of glucosamine experienced an increase in blood glucose and an acute and noticeable reduction in insulin sensitivity. So they became insulin resistant and hyperglycemic. However, as I alluded to a moment ago, they found that those people with a family history of diabetes had a much stronger effect compared to those without the family history. So this suggests that people with some bit of underlying predisposition to insulin resistance could be more sensitive to the metabolic consequences of glucosamine, particularly the effects on insulin resistance and blood glucose levels. Okay, another one published in 2007. This one was a little better, I would say, because it's a little more physiological. After all, when someone is taking glucosamine, they aren't injecting it. They're not getting a syringe and pushing it in. And so in this study, they were actually taking it orally. And they were taking a standard dose of glucosamine. So a typical dose that you're going to see on the bottles of your supplements, it's going to be 1.5 grams, which is a very normal amount. But they had them do this for 6 weeks, and they looked at the effect, in this case, in overweight and obese subjects, so people with a likely metabolic problem. And then they measured fasting glucose, and they measured a very good test, what's called a post-hoc test of insulin resistance called the HOMA, H-O-M-A, the HOMA score. And I've talked about that before. Okay, what did they find? For most participants, they didn't find anything, that after 6 weeks, there was no effect on the plasma glucose or insulin resistance. However, at the end of the 6 weeks, there was a subset of participants who did show an increase in fasting glucose. And it was these people who had some insulin resistance already detectable. So the people who tended to have the higher HOMA score, again, a sign of insulin resistance, were those people who appeared to have a hyperglycemic effect from taking the glucosamine supplement. Now, let's transition to another study, once again published in 2007. This was a randomized, double-blind, placebo-controlled trial, so the best of the best, what's considered the gold standard. And they looked at the impact of both glucosamine alone and glucosamine with its famous addition, chondroitin sulfate. And they looked at the effect on insulin sensitivity in people with osteoarthritis, so the people who would be normally taking it. Speaking of normally taking it, they gave them, once again, a normal oral dose. So taking the capsules like you would normally take and it was at the level of 1.5 grams a day. And this was a little longer than the previous study. The previous study I mentioned was 1.5 months, and this one was 3 months. So that one was 6 weeks, and this one is 12 weeks. So it's double the length. And fasting glucose levels and insulin sensitivity were measured at the baseline and again at the end. What did they find? They found no significant changes in fasting glucose levels or insulin sensitivity were observed in most participants. So that suggests that the glucosamine at these doses did not universally disrupt glucose. But once again, however, there was a small subgroup with some degree of insulin resistance already who showed a mild but significant increase in fasting blood glucose levels. So once again, an effect in some people showing a hyperglycemic response. Now, these studies that I've been showing are almost 20 years old. And just so that you don't think that the field of research on this topic has stopped, I wanted to end the research focus with a couple last ones, both published in 2024. So the first one, this first one is a clinical trial looking once again at the short term with low dose supplementation, with the outcomes being measuring insulin sensitivity and blood glucose levels. And the participants was a diverse group, generally healthy, but with people, including some people with a pre-existing insulin resistance or even being overweight. Following the theme, the results showed that short-term glucosamine use had minimal effect on blood glucose levels in the healthy individuals. However, participants with underlying metabolic conditions, like those with some insulin resistance or overweight, had increases, once again, in blood glucose levels. This once again suggests that glucosamine could have an effect of exacerbating an underlying metabolic problem. And then the final study, at this point, I'm sure you're getting a little bored of the redundancy, once again published in 2024. This is a little unique because it was an observational study, so it wasn't a direct intervention, just basically following people and having them answer questionnaires. But they found that if people were taking glucosamine and they were metabolically healthy, there was no lingering or long-term effect. However, those with a family history of type 2 diabetes, or in other words, a predisposition to type 2 diabetes, or in other words, some degree of insulin resistance, once again showed an increase in glucose levels. So the general takeaway from all of these is that the metabolic impact is, and I'm not done, we'll still finish this up, but just to sum the studies up, the metabolic effects of glucosamine really depend on the underlying metabolic health. All right, so those are some of the studies, and there are many, many more I could have shared. But it's all following a theme. Let's talk then now about the mechanism. Let's dig a little deeper in finding out what is it that once the glucosamine gets into the cell, be it through GLUT1 or GLUT2, why is it now eliciting this metabolic effect with some degree of insulin resistance, getting worse in people who already have a little bit of it, and in those same individuals, blood glucose levels going up. So this steady rise in fasting glucose levels. So to get into that part of the mechanism, we need to mention this process within the cell called the hexosamine biosynthetic pathway. What is the hexosamine biosynthetic pathway? This is what's considered a very minor pathway. Typically, when you think about glucose coming into a cell, you then think about the cell using the glucose through a process of glycolysis, where you're breaking down the glucose for energy, or you're breaking it down to get to a more fundamental molecule to turn it into fat or into glycogen. But there is this minor pathway where up to 2 to 5%, 5% being on the high end, up to 5% of glucose that comes into a cell will be diverted from the glycolysis pathway and all of the potential consequences that I mentioned a moment ago into this hexosamine pathway. Now, what is the purpose of hexosamine? It is to produce a molecule, and this is a long word, but I'll give a nickname for it in a moment, UDP-N-acetylglucosamine. Often this is just abbreviated or shortened as UDP-GlcNAc, and that would be just UDP dash, if you want to look this up, UDP dash GLC, that's the gluc that I just said, and then NAC, N-A-C. All right, GlcNAc, UDP-GlcNAc. This is a key molecule within the cell and has a role in myriad roles within the cell. But when UDP-GlcNAc goes up, what was once a normal, healthy part of the cell becomes a potentially harmful part of the cell, because it is known that UDP-GlcNAc can attach to insulin signaling proteins and disrupt them. In fact, it can attach to two of the most critical at the beginning and near the end of the pathway, depending on the particular path we're actually talking about. So when insulin comes and binds its receptor, the next step will be the activation of what's called the insulin receptor substrate. And there are multiple of them, but it is the IRS family of proteins, insulin receptor substrate. UDP-GlcNAc will bind to IRS1 and block it from working. So even if insulin comes and binds to the insulin receptor, with the next step normally being the activation of IRS1, if UDP-GlcNAc has moved in there, it stops it right there. Now, even if it doesn't stop it right there, once IRS1 is activated, there's going to be a series of events, not too many, that will get to the activation of another protein called AKT, sometimes known as protein kinase B. But it was firstly called AKT, and that's what I call it. So AKT is a necessary activation event further down. So even if UDP-GlcNAc missed the IRS1 blocking, it has the opportunity to block it further at AKT, which is a very critical junction in insulin signaling. So the more glucosamine coming into the cell, the more of that glucosamine actually can boost the production. Like what would have been just a minor contribution from glucose producing UDP-GlcNAc. Now that you have a lot of glucosamine coming in, glucosamine can boost the production of UDP-GlcNAc, which is in turn then disrupting the insulin signaling pathway by blocking IRS1 and AKT. Now, that's going to just be causing insulin resistance in a general sense, and all of its myriad consequences, including the plagues of prosperity that I've talked about, and won't revisit now, but all of these general chronic diseases. If it's a non-infectious chronic disease, insulin resistance likely has a contributing role to it. But even if we don't get that far down the road, one immediate effect of this is going to be an increase in blood glucose. If you're blocking the insulin signal, you're going to make it harder for insulin to open up some of those other glucose transporters, in particular GLUT4. And GLUT4 is a very dominant signal, or a very dominant glucose transporter. But regardless of which cell type or tissue type we're talking about, if you have more glucosamine coming into the cell, you have more production of UDP-GlcNAc, then you have more disruption of the insulin signaling pathway. So that there becomes one way, especially at the liver. The liver has a very important role in pulling in glucose and storing it for later. But if you're blocking that ability, you're not only what you're likely having occur here is that the UDP-GlcNAc is preventing insulin from keeping the glucose locked up as glycogen. And then you have, with less of an insulin signal, less of an inhibition to break down glycogen. And glycogen, just by way of reminder, is the storage form of glucose. And it's something that the liver does very well and very importantly. Now, however, if the liver has become insulin resistant, perhaps because of excess glucosamine turning into excess UDP-GlcNAc, now you have a liver that isn't getting the message from insulin, trying to tell it to hold on to the glycogen, and rather the liver is breaking down the glycogen, releasing it as glucose into the bloodstream. The consequence of that, of course, is going to be to increase blood glucose. Now, that's a well-known, well-documented series of events. Glucosamine to UDP-GlcNAc, and then the attack, if you will, on a few key points of the insulin signaling pathway. However, I wanted to propose one more, but please appreciate that I'm speculating now because I actually didn't find any substantial evidence to support this. Given that glucosamine is known to compete or to be transported into cells through glucose transporters, GLUT1 and GLUT2 in particular, I can't help but wonder whether if someone is taking a lot of glucosamine, is that potentially creating a problem where the glucosamine is out competing the glucose, particularly in the liver? where you have GLUT2, and not only liver, it was liver, kidneys, pancreas, and gut. All of that, those are potentially very big tissues with a very big potential influence on pulling in glucose. If you got a lot of glucosamine, then the glucosamine is slipping into those glucose transporters. There's not room for glucose to slip in at the same time. So it's possible that the glucose is going up in the blood simply because you are preventing the cells from taking it in as well. All right, but that one's more speculative, but it sure makes a lot of sense to me. All right, what does this mean for you if you're taking glucosamine? First of all, appreciate the actual limitations on making strong conclusions about it. That if you are taking glucosamine and you swear it helps, you should just be honest enough, cognizant of the reality that it could just be pure placebo, that there is substantial evidence. And indeed, my general view is that the evidence actually suggests glucosamine does not improve joint health. However, I know people who take it and swear by it, and I would tell them to keep taking it, especially because those same people are very metabolically healthy. And that kind of brings me to my point about a sort of risk assessment, that if you know you've got an underlying metabolic problem, whether you have type 2 diabetes or you have insulin resistance or you have a family history of type 2 diabetes, which means you are at a much greater risk than normal, I would say it might not be worth it. If you are metabolically healthy and you don't have any of those underlying metabolic concerns, then I would say take it. It's not going to hurt you, even if it's not necessarily helping you. I would also add that if you are taking glucosamine for joint health, now there are myriad explanations with joint problems, but there are other known stimuli that hurt your joints, like improving insulin sensitivity. For example, I documented in my book, Why We Get Sick, like over the book that is over one of my shoulders right now. I have a whole section devoted to the insulin resistance origins of osteoarthritis. Uric acid can exacerbate joints. Certainly it can do so by causing inflammation of those joints. So improving insulin sensitivity, reducing uric acid, all of those are going to be very effective ways of reducing joint pain. All right, now some closing thoughts. So there's this dual nature. There's this war of sentiment or effect when it comes to glucosamine, that while it may offer some joint pain, it is important to consider the potential metabolic impact, especially for those with underlying insulin resistance or family history of diabetes. And then, of course, like all supplements, glucosamine isn't going to be an ultimate solution. So you need to understand your risk. You need to be honest about the benefit of the glucosamine. But of course, I'm not giving any sort of advice in this regard. The nice thing is, even in those studies that show an actual statistically significant, and I would say meaningful effect, it is going to be something that's always going to be transient. That if you notice your blood glucose levels are getting a little persistently elevated and you happen to be taking glucosamine, I would suggest it's certainly worth experimenting and seeing whether cutting out the glucosamine helps lower the blood glucose levels. Because that is going to be the stimulus. So it's a pretty acute stimulus, which is good, because if that is having an effect, you can resolve it very quickly. All right. Given how popular glucosamine supplementation is, I hope that this lecture has been helpful and insightful. If you know someone who's been taking glucosamine, by all means, share this with them. Thanks for joining me for the lecture today. And until next time, remember, more knowledge, better health.